Moving on now to the latest on the coronavirus pandemic. After several days of seeing some of the lowest numbers of cases in months, Miami-Dade saw a sudden spike in the numbers, but our local leaders say those numbers are actually misleading. Officials are now pointing the finger at a local lab as the source of all the confusion. The latest numbers from the Florida Department of Health reports a little more than 8,000 cases, with more than half of them coming from Miami-Dade alone. But many of these new infections actually happened several months ago. CBS 4's Brooke Shafer joins us live from Miami to explain. Very confusing. Brooke, what's going on?
Yeah, hey, Francis, good morning. According to the Florida Department of Health, the patients have been getting their results continuously, but the Department of Health didn't get this data until yesterday. All of these numbers going all the way back to June.
A data dump from the NISNIC LabCorp added more than 4,000 positive cases to Florida's single-day total, including an additional 2,900 for Miami-Dade. But those positive tests are from as far back as June. Governor Ron DeSantis called them stale numbers.
Stale test results shouldn't be used by policymakers to determine the way forward for students, parents, workers, and businesses in the here and now. I've instructed the Department of Health to remedy this.
The Florida Department of Health says Wednesday's total for Miami-Dade shouldn't be 4,104, but instead 1,163, and the positivity rate at 12.4% instead of 18.3.
What everyone's been doing the last couple of weeks is working. Things are getting better.
Infectious disease specialist Dr. Aileen Marty says it's better to focus on hospitalization rates.
We're starting to see fewer admissions to hospitals, which is a better indicator of what's going on. So, for example, today we had a total of 100 new patients admitted to hospital, and we released 190. That's a good trend.
She says that's much better than a few weeks ago. Broward County is seeing drops as well. At Broward Health, they're only treating 136 COVID patients.
We've substantially decreased our number of admissions and increased our amount of discharges over the past several weeks.
In Miami-Dade, Mayor Carlos Jimenez has stated reopening things like indoor dining at restaurants won't happen until the 2-week positivity rate gets between 5 and 10%. But Dr. Marty says her advice is to get as low as possible.
10% is the bar that was set by the Center for Disease Control, but it's a kind of a risky setting. Let's do it right the first time, or the second time in this case, and try and get it much closer to 5 before we start really opening up. That would be my advice to the leaders.
The CEO for Jackson Health tells CBS 4 he credits the recent turnaround to mask compliance, curfew, and restaurant restrictions.
It's not about government control and shutting down things. This is about the community behaving.
And Francis, the CEO of Jackson Health, also said that if this trend continues, he thinks we could hit that 5 to 10% infection rate for that critical 2-week period by next month, mid to late September. I'm live in Miami. Brooke Shafer, CBS 4 This Morning.